I would say harm reduction is radical love. It's meeting people where they're at, loving them right there. Syringe service program, fentanyl test strips, naloxone distribution, safe sex kits, wound care kits, Hep C and HIV testing, and resources for treatments.
All right, welcome everybody to the One Moment Podcast. You got your boy Kevin Odom and co-host and co-founder, one of them anyways, Josh. Today we have an amazing guest. I have read over her bio. Josh has had the privilege of talking to her before I got on. So without further ado, I am going to let ladies go first with their intro. Miss Michelle.
Yeah, I'm Michelle Charbonnier. Professionally speaking, I am a therapist, a mental health therapist. I specialize in substance use disorder, and I'm executive director of a nonprofit. It's a recovery community center rooted in harm reduction. I came into this line of work through my own recovery. So I'm a person in long-term recovery, which led me to this passion.
Very nice. So, just to kind of get us started off a little bit, what would you say is first, what is harm reduction? Just for the people who don't know, let's start from ground.
Yeah. The basic stuff. So I would say harm reduction is radical love. It's meeting people where they're at, loving them right there, giving them resources to be safe in whatever decisions they make. Practically what that looks like is a syringe service program, fentanyl test strips, naloxone distribution, safe sex kits, wound care kits, Hep C and HIV testing and resources for treatment, hygiene kits, things like that.
Okay. All right. And so I'm going to go ahead and just broach the topic that I'm sure you've heard before. And that is essentially, are we helping or enabling when we do harm reduction? Because I actually am a member of a harm reduction organization myself here in Greenville. And I hear that quite a bit. And a lot of people are just pushing just for straight recovery. And it's like, no, my understanding is, you want to meet these people where they are. Like you said, not everybody is ready for recovery.
Yeah.
So you really got to meet them where they're at and kind of help just show them love, that radical love. So in your words, what is the difference between enabling someone and just meeting them where they're at?
Yeah, I think that enabling is people see enabling as encouraging the use, right? Allowing them to continue to use as if we allow people to do anything, right? We all do what we want. Um, I think meeting people where they're at is really about recognizing that people are going to do what they decide to do, right? I don't get to decide if someone engages in sex. I don't get to decide if someone engages in drug use. I don't get to decide if somebody drives a car and wears a seatbelt. But what I can do is give them resources to be safer in those practices and to reduce the risk of harm. I always go back to the roots of harm reduction being in the HIV epidemic in the 80s. Back then, people said, don't give kids condoms, then they're going to have sex. They're having sex anyway, right? Let's give them the tools to be safe. And even before that, when you look at when they wanted to put seatbelts in cars, people said, we can't do that. Then people will speed. We're going to speed anyway. This is going to reduce the risk of harm. It's going to save lives. And so I think we recognize that we don't get to decide other people's decisions. And it's not up to us what other people put into their bodies, but there are safer ways to do it. And if we can teach people how to be safer, it's going to improve the overall health of our communities.
Okay. So thank you for just kind of cutting the line between the two a little bit per se. So the follow-up question is, how many clients do you serve and how many of them do you see actually going into recovery and be successful?
Yeah. Well, I think part of what we do is embrace the idea that harm reduction is recovery. When somebody comes into our center and for the first time they're going to use sterile syringes and they're not going to share and they're going to properly dispose of their syringes, that's any positive change. That's improvement, and that is their recovery, right? I think allowing people to define their own recovery is really important. As my work as a therapist, I see a lot of people who have an issue with alcohol, or maybe it's opioids or cocaine or something like that. And they want to get sober off that, but they want to continue to smoke weed occasionally, or they want to have the occasional drink or whatever it is. And that's okay. And it doesn't mean that they're not in recovery. So part of the work we do is to change the perspective that the only path to recovery is complete abstinence. That's my personal path. I really enjoy caffeine and I really enjoy processed sugar, and that's not without its harms, right? But my path has ended up being abstinence, but it's not for everybody, and that's okay. And so I think it's important that we don't define recovery for other people, that we allow them to define that. And for us, success looks so we let each individual person define success. When they're engaging in our services and being safer and they're carrying Narcan and they're saving lives with the Narcan, that's success. We last year we made the decision to hire our first participant, a person who uses drugs, which is really important in the harm reduction field. And because she has a job, she now has stable housing. She got for the first time has an ID and a social security card, and was so excited to have these things and to buy them for herself. She never thought she was worthy of having a social security card. She didn't think she deserved these things. And so that is improvement. That is success. We send anywhere. So on average, you asked for a number of clients. We see on average 1,500 individuals a month. So I'm located in St. Louis, Missouri. So we're in a city, right? So we see a lot of people. We have a brick and mortar. People come in all the time for services. We also do street outreach. So like we're in South St. Louis. Our street outreach is taking our services to like downtown St. Louis and North City, to the people that can't necessarily get to our brick and mortar. So we have a wide span within the city. And we see average 1,500 individuals. And we have more, we see them multiple times, right, a month. So those are the number of individuals we serve on any given month. And we're constantly making referrals when people are ready to treatment, to housing, to job resources, to whatever it is they need.
Wow. So first off, just kind of thank you for just kind of reminding me the difference between like recovery and abstinence. Cause even though I know it and I've had to explain that to other people before, it's just, I don't know, it's the stigma has been ingrained in me so long that recovery is abstinence. And even though I know that's not the case, I just go straight to it. That's like my automatic processing is go straight to it. So thanks for correcting me on that and just kind of, remind me like, hey, those are two different words. Words have meaning. So 1,500 people a month. Now, I know in North Carolina where we're at, we're able to give our clients a card that essentially says, hey, if you're stopped with any what would be considered on the streets paraphernalia, but essentially it's just medical supplies that come from us, you can't be charged with them. You can still be charged with the drugs if you have any drugs on you that are illegal, but you can't be charged for the medical supplies. Do they have anything like that in Missouri or?
No, Missouri is a red state. It's scary. It's scary in our country right now. It's scary in our state. St. Louis City is relatively safe for what we do. But it's not even legal to run a syringe service program in Missouri right now. And so there is no real protection. There's the good Sam law, which protects people if somebody overdoses and you call 911 and you stay, you have some protection under that. But even that's really limited. So there is no protection. There is no type of law that works in our favor or the people we serve's favor.
I'm just thinking like, how much of a barrier do you think that is for people in the community who need this service?
It's a huge barrier. Like the idea that the political climate is so harsh and unloving right now, is a huge barrier. And it's not just politically or like within our city. There's an issue in the medical field, right? Like the people we serve, wound care is one of our participants' biggest needs. So we do wound care all the time. And all the time we're saying, we can only do so much. You should go to a hospital. They're not going to go to a hospital because of the way they're treated by medical professionals, because of the stigma, because of the shame that happens in these settings. We for a long time, we were about a block, 2 blocks away from a hospital, and people would have somebody dead in their car from an overdose, and they're coming to us before they go to the hospital because they do not feel safe in the care of those professionals. That I think is one of the biggest struggles. Not only do we need to we need to change the public's perception of drug use and people who use drugs, we need to train people on radical love and what it means to just meet people where they're at. But we need to be training medical professionals on this because they don't get that training. Nurses, doctors, they don't get training in compassion. They don't get training in harm reduction. They don't get training in meeting people where they're at.
Yeah, kind of think of so my fiance works in the hospital. She's a psychologist, and she's essentially told me that she's got referrals before because somebody gets a cancer diagnosis and they're crying, and the provider doesn't know what to do, so they send them to psychiatrists for a psych eval
Exactly.
because they're crying because they just found out, that essentially they've got cancer, and so yeah, they don't know how to handle that, and so yeah, I can definitely see how that.
And very grateful for medical professionals, right? Like, I'm so glad people know how the brain work and how to operate on it and all of those things. That's great work and we need it. But we need people in those systems that know how to be compassionate.
Yeah. Huh. How did your organization start? If it's essentially like a very much a gray area to
Mhm.
even be doing this community outreach, and that's what we've had to call ours now is community
Yep.
outreach. You can't call it
Yep.
harm reduction. How did yours start?
Yeah. So the co-founders started it in 2015. So 10 years ago, they were grassroots harm reduction. They were running syringes and naloxone out of the trunk of their cars, distributing it when they could. They had enough money to like rent a small space. And I came along as a volunteer in 2017. We were all volunteers. It was basically like the office is open when a volunteer who's not working their full-time job can be there, as
Yeah.
most nonprofits start. And in 2018, we got funding through the Department of Mental Health to be a recovery community center, which allowed us to open our doors on a full-time basis and to start really serving people daily. So it's expanded so much since 2018 with more funding and adding street outreach. We actually run the mail-based naloxone program for the entire state of Missouri. So people in rural Missouri who don't have access to places, they can't walk into buildings like ours because it's not there, can go to our website. They can request Narcan, fentanyl test strips, all that kind of stuff. We'll mail it to them.
Nice. Very nice. So yeah, I know that you talked a little bit about funding, and that's something that the director of the program that I'm a part of, it's very much like, the forefront. How are we going to pay for this?
Yeah.
People supplies aren't cheap. Place to rent, even for a day a week, is not cheap. And so I know she has had to stop taking government funding for quite a while. She was getting part of the opioid settlement money,
Hmm.
uh, and now she's having to stop take it because of the fact that the way the new law that they're trying to pass says, like, if you serve members of the homeless or those without housing community and they have drugs on them and something happens, they get arrested on your premises, like the director and everybody who's working there can also be charged. So like, and that's if, essentially if you get funding from us, you have to follow this rule. So yeah, how did that kind of come about as far as like the funding from y'all? Did y'all have any regulations that came along with that? Anything along those lines?
Yeah. The funding is a gray area, especially now, right? And harm reduction specifically is under attack by our current administration. Luckily, because we are a recovery community center that's provided us some safe space a little bit. And so we don't have, it's made very clear to us that most of the grants we receive, the ones that are specifically for recovery, do not fund harm reduction. And even the ones that we receive that fund harm reduction cannot buy syringes, cannot buy Narcan, cannot buy the actual supplies that we need. So it's like, okay. So there's lots of stipulations. And we do our own fundraising. We bring in private donations and we have fundraisers to buy the supplies that the other grants are like, we support the work that you do.
But
Don't
not
use
this
our
much.
money for it.
Yeah. Yeah,
Yeah.
yeah, I've definitely
Yeah.
seen that before. We have to we have to essentially log everybody who walks in the door based off of if they get syringes or not. Just
Yep.
point out blank, because if they don't right now, or technically I think the funding is over, but before, like if they didn't get syringes, like everything had to come out of pocket for any services that they received. And so that was just how it was, like, yeah, it was just one of the questions we asked essentially.
Yeah.
So yeah, I understand completely how. Now, do you know if there's any like any advocacy or anything like that going on in your state? Because I know you mentioned that they were not very fond of this this approach. Do you know if there's any advocacy that's going on in your state to kind of change that or push for another way? 'Cause
Yeah.
at the end of the day, it's politics. I hate talking about politics, but
Yeah.
this is politics. It is what it
Yes.
is.
It is. It is. And like how crazy that, because to me, harm reduction is just logical and common sense, and like it's just being a good human, right? But we have to like train people on this. Like, let me explain to you what it means to be a good human. So there is legislation in the works in Missouri this past year. There have been efforts to bring awareness to this. We actually had our state rep here this morning. We were meeting with her, who's very supportive of the work that we should do. Her background is social work, so she gets it.
Yeah.
Yeah, she gets it. She's supportive of it. She's like all on board.
Probably one of the more radical forms of the
Right.
therapy community is social
Yes.
work. Yeah.
Yeah. So and it's a fine line we feel like we're walking right now, not only because we're in Missouri, which is a red state, but because of the current national administration is attacking us really. And so it's a very fine line of like, we want to advocate for the right of people who use drugs and and bring them more resources and bring them love and compassion and all of those things. And we also don't want to expose them and put them at risk and risk our own funding in our ability to serve them. So it's a very fine line. And the state rep said this morning, she was like, and my philosophy as executive director has always been, I'm not going to change the world by legislation. I'm not going to change the world by being political. I'm going to change the world by being boots on the ground, serving the streets, meeting people where they're at and taking care of them. And so that's always kind of been my philosophy. And that she actually said that this morning. She said, you let me do the legislation work, the lobbying work, all of that kind of stuff. And you keep meeting people where they're at and doing this work. So we have to find those partnerships of people that are willing to show up in those spaces and do that kind of work.
But I want to kind of build on to or kind of add to one of your political questions. I know on the One Moment podcast, we don't take sides as far as like politics, but politics is a part of everything we do. Unfortunately, we can't get away from it. So I guess my question is, because in North Carolina we got one of the bills is being proposed right now as we speak is anything related to DEI, right? And I don't mean like DEI, so to speak, as it's has been, but the stuff that we have questioned in North Carolina is, does it mean that I can't mention a different race in my clinical notes, right? In my clinical documentation, or I can be prosecuted criminally. So, like, we're fighting against certain pieces of legislation similar to what you were saying. My question to you is, given the current state of the politics, now, North Carolina, let me preface this. North Carolina, we're about 50-50, right, Josh? We're about half
Very
Republicans.
close. We
Yeah.
generally have like red House Representatives, red Senates, and a blue governor. That's
Yeah.
just really how we've been ever since I've been living. So I don't see it changing anytime soon, to be honest with
Every 4 or so years we do a complete flip flop.
you.
You know, it's weird. North Carolina's weird. My question to you is, given the state of the current political environment, whether it's red, blue, what have you, doesn't matter. What do you think needs to happen when you say boots on the ground? Like, what is it that providers need to do, patients need to do? What do you think is the most critical there, or the most important aspect of continuing to advocate for harm reduction and necessary services that are life saving?
Yeah. Education and destigmatizing. I think people need to understand harm reduction better. They need to understand where the roots of it, where it started, why we do it, and the effectiveness of it. We have over 40 years of saying harm reduction works. Harm reduction reduces overdoses. Harm reduction reduces Hep C and HIV spreading, right? Like it works. Overdose prevention sites work. And so understanding the data and educating people to understand that we're not encouraging people to use drugs. We're recognizing that they're going to use drugs regardless, and we want them to be safe. And that this isn't an isolated community, right? Like people who use drugs, any given community is only as healthy as its sickest individual, right? And so for an entire community, whether that's your neighborhood or your city or your state, to thrive, we have to be supporting the people that are struggling, the people that are sick, the people that are vulnerable. And to do that, I think it's really about meeting people where they're at and asking them what they need. You know, a lot of our people are unhoused and we do the street outreach. So we go to like encampments and things like that. And in my like friend circle, I had one friend one time say something to me that really stood out to me. She had met somebody that was unhoused, that was like asking for money or whatever, and she offered them food and the person turned it down. And my friend got mad about it. And and she's conveying the story, right? Like, I offered them food. I can't believe they turned it down. And I said, well, did you ask them what they needed? And she was like, no. And I was like, well, there you go. Like, if you just ask somebody what they need, they'll tell you. We can't assume what people need. We can't assume that everybody who has cancer wants to go through radiation or chemo, right? We can't assume that people are going to make certain decisions or have certain needs. We need to give voice to everyone to tell us what their needs are. So I think educating everyone around this, destigmatizing it, and recognizing that everyone's decisions impact the community and we need to make safer decisions. I also think that it's this idea that like we have towns that we've referred to as like NIMBYs, not in my backyard. This doesn't happen in my town. My kids don't do drugs. That doesn't happen at their high school. Things like that. And until somebody in their community dies, and then they're like, oh, I had no idea, and we should
Yeah.
do something about this. It's there, right? My private practice is in a suburb. It is well-to-do. It is people who can private pay for their services. It's people that can drop lots of money to pay for whatever treatment they need. And it still struggles with substances and alcohol that they're coming to me for. So that part's not different. And socioeconomic status doesn't matter because this disease doesn't discriminate. So I think educating the community, people, medical people, everyone is an important step in that direction.
Yeah, I mean, it's one of those things. You take a basic alcohol and drug class in college or even high school, and it'll say like, the statistics of like 2 in 10 individuals will develop a issue with drugs or alcohol. It doesn't list like 2 out of 10 Caucasian or African American. It just says 2 out of 10. It's just flat across the board. It doesn't discriminate. While there are some ethnicities that you see a little bit less in, it's not by much. They're very much about the same. And it's obviously the rebound some with a little bit more. It's still, it affects the community as a whole, not just a particular subgroup. So kind of denying its existence is not going to do anybody any favors. I can see how you can say the psychoeducation component is just, hey, like, this is happening, bud. Like, whether you like it or not, it's here.
It's here. It's
I think
happening.
that from my own personal experience, the opioid epidemic kind of essentially brought it to the white suburbs. Let's just call it what it is, people. It brought it to the suburbs, and when something happens in the suburbs, then you see some type of policy change. And so I think that's kind of what we saw a little bit. And so they realized like, oh crap, this is here. This isn't like the so-called crack cocaine epidemic that happened, essentially in low socioeconomic areas that were predominantly people minorities. This happens, in our backyard. So now you see the change then. like the Mothers Against Drunk Driving that was, happened in our suburbs. And even a lot of the harm reduction laws, the Good Samaritan laws, those came about because of they happened in the suburbs. That's just is what it is. That's where it came from. Um, and so, yeah, I can definitely see how psychoeducation component is it's key, and I love that you kind of point that out. I would love to shift just a little bit if we can, and if you're okay with it, and essentially talk about you being a person in recovery. And essentially just call it what it is. You're around people all day who are they are not, you're meeting them where they're at, and they may be in a place that, may not be healthy for you. What do you do to kind of essentially bring resilience in your own recovery to still be able to help those individuals?
Yeah. You're asking me what my self-care is, right? What my
Exactly.
recovery looks like. Yeah.
Yes.
Yeah.
Does anyone else have that one tool that makes building a website a breeze? In an era driven by digital change, WebHash is the indispensable tool that holds the key to effortless website creation. Create websites that endure, defy censorship, and bypass any single point of failure. As cutting-edge technology redefines reality, seize the power to build beyond limits. Join the Web3 revolution now and forge paths others can only dream of. Visit our site today and build your legacy. Building my own space on the web was always a grind until I hit up WebHash. Their no-code builder is my ace. It's swift and solid. It's like rocking a digital fortress that's immune to the typical shutdowns. Level up your web presence without stress. Ready to stake your claim in the digital realm? Dive into WebHash today, connect your Web3 wallet, and get started. They have multiple subscription plans, from a free version to a lifetime subscription. Check them out today at webhash.com. Most importantly, they sponsor the One Moment podcast, helping to raise awareness to critical topics in the healthcare field. Our official website was built using the WebHash platform. Throughout the projects that the One Moment movement built on WebHash, they stood behind and supported it all the way. Sign up and start building your website today. Don't forget to visit onemoment.chain.box and subscribe to our social media channels.
I never envisioned coming into this line of work. In fact, my own recovery, I went to an intensive outpatient program. I had a therapist, just I did all those things, but I did not do 12-step. I'm not a 12-stepper by any means. I had no interest in going and sitting in rooms and talking about doing drugs. And I had just spent 20 years doing drugs, selling drugs, making all the things. I was not interested in sitting around and talking about it. Obviously, I did it in a clinical setting when appropriate, but that was not my path to recovery. So I ended up, church was a big part of my recovery. Finding community there was important to me. And at my church, I eventually was asked to lead a recovery support group. And so I did it, and I loved it so much. I sought out more opportunity, which led me to the nonprofit and then led me to becoming a therapist. And so figuring out boundaries, what else? Even before I got completely sober, I was in relationship with a therapist. I've been in therapy since I was probably in college. I value that relationship. I'm a I'm a therapist, and you should never have a therapist that doesn't have a therapist, right? So I stay in relationship with a therapist. I stay in relationship with trusted spiritual mentors. I stay in relationship with my community, my faith community, my yoga community, my family, people that understand my path to recovery, that support me. I make sure that I'm taking care of myself physically, exercise and yoga, good nutrition, all of that stuff. I make sure I see my psychiatrist regularly. And I don't make major life decisions without consulting those important people who I trust, right? Um, and so I think that's an important part of what I do. I recognize that I- I'm not one that gets triggered by being around like the people we serve at the nonprofit or my clients or anything like that. Um, if I were to walk into like a party where everybody's drinking and doing a bunch of cocaine, that could be triggering to me. Spending like I don't make it a habit to spend time at bars. Like, I don't avoid them if I'm going there to eat or something like that. But
Yeah.
I'm not like, that's not where I hang out, right? That would be a trigger
Doesn't
to me.
sound fun to you.
No,
Yeah.
no, not anymore. So I don't make it a habit to participate in those types of places or things any longer. Um, and so the work itself isn't triggering to me, but I know what my triggers are and I know how to negate them and to manage them if they do come up. So community, taking care of myself, having boundaries. I think that's something I get asked a lot. Like, how do you have boundaries? And I always say, like, I work with humans and not animals, because if I work with animals, I wouldn't have boundaries. Like, I would take them all home with me. Dogs, cats. I'd be like, yes, I'll take 20 dogs to my 1-bedroom apartment. They all need homes.
Yes.
Um, but I can have boundaries with humans, and I can make it clear of like, okay, we're closing and you got to go and we'll see you tomorrow type thing. And I preach that to my staff as well, is to have our boundaries and to recognize that we serve a population that have great needs: food, housing, um, clothes, socks, hygiene. They have so many needs, and we're not capable of meeting all those needs. We have to know what we're good at and kind of stay in our lane and do that. And so recognizing our role in everything is important to make sure that we're taking care of ourselves.
I completely understand what you're saying. I know a while back, one of my supervisors essentially taught me the easy way to maintaining boundaries. And it was essentially just blame everything on either procedures or ethics. Like, man, I'd love to be your friend. I'd love to hang out with you, but it's against company policy, bud, or
Yeah.
it's against, the board policy. I just can't
Yep.
do. And so it makes it one of those things where, like, you can say, you can recognize I enjoy our friendship and relationship where it is, but like, I can't go any further. It's
Yeah.
just not allowed. And you just
Right.
kind of cuts it off and ends it right there.
How do you feel like your recovery influences or impacts your clinical decision making?
My decision making?
Your clinical decision making.
That's a good question. My lived experience, again, led me to this line of work. And I recognize that my path to recovery is not everybody's path to recovery, and everyone's is different. And so I'm always willing to explain that to people, right? And I don't, when a client comes to me for therapy, right? I say, we the whole thing of like, there's so many types of recovery out there, recovery support groups, and I talk about all of them, and I'm like, you should try all of them. You should go to an AA meeting, you should go to an NA meeting, you should go to a Celebrate Recovery. Like, try them all and keep trying them till you find your people, you find the meetings that work for you. And maybe meetings aren't your thing, right? And you find a different community, and that's okay too. And so I think it allows me to really encourage people to find their path and to define their recovery. I don't want anyone to come to me and feel like they have to do things a certain way, or they have to take a certain medication or not take medication or any of those things. So I see it influencing it that way, helping people define recovery. And to me, as a therapist, like, recovery not just from substance use, recovery from anxiety and depression and grief and divorce and like all the things, right? Because for me, I had to realize that I'm not just recovering from a problematic relationship with substances. I'm recovering from the lies I told myself for many years, and from that story that was spoken over to me as a child by a teacher that told me I wasn't enough, that told me I wasn't worthy. I'm recovering from having that narrative my entire life. That's really the work that I'm doing. Because not using drugs, figuring that part out was relatively easy. Figuring out how to do all the other deep work of like, but why did I really use drugs is the hard part. And so I encourage people to also kind of dig into the whys and to recognize that it's not just a problematic relationship with alcohol or drugs. It's rooted in something else.
My next question is, do you feel like substance use is a brain disease, or do you feel like it is more a disease of existentialism?
I love that question. I think it's both. I think it's both.
Okay, well, explain your reasoning then.
Yeah. So I think we can explain it as a brain disease, right? Like we have the evidence for that. Science can back that up. We create new neural pathways. Drugs impact our brain chemistry. Alcohol impacts our brain chemistry. And so all of that just makes sense. I think at the core, people are searching for something more. I believe humans were designed to search for something greater than ourselves. And so because I meet people where they're at, if they're on the path of it's an existential crisis, I'm right there with them and I'm like, yes, let's work through this. If they're on the path of like, this is a disease and I want to treat it as a disease, tell me the medication that I need, tell me how, my triggers and my, all my cravings, how to manage those things. I'm there to do both. And ultimately what I really love are the clients that want to do both pieces, right? They want give me the medication if the medication helps. Tell me how to manage triggers and cravings and urges and all of those things, but help me to go a little bit deeper and figure out what's going on within me and something greater outside of me that's also within me to help me move through this. I don't know if that was the answer you're expecting, but that's my answer.
That was the answer in the most simplest form ever. Yeah, yeah. I think that's a question that I've been challenging the last couple of years because for the last decade, well, up until about 2 or 3 years ago, there was this huge push on. I mean, everywhere you went, it doesn't matter who you spoke to, what type of educational program it was. It was all around the brain disease model of addiction, and probably around 2021, 2022, that's when I started seeing a different path come in the substance use field. And that just shows me that every decade we'll get this huge boom and this be this main focus for about 10 or so years, and then it'll switch up a different focus, and it'll switch up after that. So that's why I was asking to get your perception, because I don't see now as much of a push as it was 2021 and prior. And I see more of now this harm reduction approach, finding meaning and hope in life. Let's look at your experience. What does it mean to you? What does this drug mean to you? What is it telling you? Things like that. So that's why I was asking. I wanted your perception, because I am. I don't know if I fully concede to the brain disease model, but I am an existential person.
I think we're all having existential crises. Not everybody's ready to admit it.
Ooh, I love it. I love it.
Kind
Yeah,
of going back to the clients that you see that they're like, essentially, give me whatever it takes that'll work.
Mhm.
Because it's like, hey, I've tried everything. I'm hopeless. I don't know what to do. I'll do anything essentially. Versus the ones like, I want this, but not this. Those
Yeah.
kind of things. You're like, okay, now we have more resources to pull together. We have more tools to put in that toolbox.
Mhm.
Hoping something essentially, you find useful. Um,
Yeah.
yeah, much more of the medical model myself. I enjoy that a lot more, but I also recognize how spirituality, meditation, things like that play a part in one's recovery. And I use the medical model and research to show, like, hey, if you have the spirituality, this existential side, research shows that it probably will help you recover from
Mhm.
many, many diseases, not just addiction. Even in hospitals, they did one study one time where the nurse staff and the doctors were able to tell how their recovery was going to go. I don't remember if it was cancer or whatnot, but they were like, they'd be able to tell the outcome of treatment based off of how holistic the person was. If the person had a spirituality component, things of that nature. And so they were kind of I remember that hospital was starting to incorporate pastoral care, things of that nature into their standard medical treatment. So yeah, I'm a little bit probably on the other side of Kev as far as that one goes. I'm like, no, I just want the science. And if the science proves the other, I'll take the other, but I just want the science, man.
We need all the approaches.
Yeah.
Right, right. And I was about to say, thank God there's no one size fits all here. Because if we all thought alike, then I don't. I mean, it could be a great outcome, but I'm also scared to find out.
Yeah.
All right, I'm gonna throw it back to you, Josh.
So I know we're kind of getting to the point where we're kind of starting to get to the wrap up point. But Miss Michelle, I would love to kind of ask you, where do you see your organization going? Where do you see the need to be the most? I know we talked about many different aspects, but where do you see your organization going and being able to help best serve your community?
Obviously, we hope to grow as all nonprofits do. We offer so many services. We do a drug checking program right now where people it's in conjunction with our medical examiner, our county medical examiner's office. So our participants give us samples of what they're using and we take it to the medical examiners. They test it and they have like a dashboard and they send us the results and we provide it to our participants, which is really important data right now. Our drug supply is contaminated and people need to know what is in their drugs. Otherwise, it's causing deaths. And so that's a really important piece. What we would really love is to bring drug checking in-house, to be able to have the device in-house to do the drug checking in real time and give that data to our participants. So that is one area we want to grow. We want to do more street outreach. As I said, we're in South St. Louis. We want to get a brick and mortar in North St. Louis. And we really want to disrupt the medical system. We want to flip tables. We want to disrupt the medical system and say, it's time that you treat people who use drugs better. I think it's time you treat all people better, but it's time you treat people who use drugs better. They have rights. They deserve to be treated like humans. And here's how you do that. Let us train you. Let us teach you. Let us walk along this journey with you. So to really educate, as I said before, educate people on harm reduction, bring awareness to it, and to destigmatize drug use. We want to give a voice to people who use drugs. Me and a lot of my staff are in long-term recovery, and our lived experience is important and it's valuable and it's something to bring to the table. But the experience of people who use drugs, people with living experience, is much more important right now than lived experience. And so to continue to give voice to them in a safe way that's respectful and to treat them with dignity is important. So our hopes is to expand our reach, serve more people, and to bring more services to the people we already serve.
Awesome. I know, just thinking of the organization that I'm with, we also offer essentially the drug screening. Ours has to go all the way to Raleigh. And I know, like you said, it would be so nice to have it on site because, hey, by the time that makes it to Raleigh and comes back, and they might show up the next week, it might show up the week after. It's going on a month before we're able to tell them, hey, your drug had carfentanil, your drug had xylazine in it. And,
Yep.
of course, let's just call it what it is. They've already used it by that point.
Right. Right.
While we're playing catch up, essentially is what we're doing. We're reporting them actually being able to, affect some change that could be made. So yeah, I understand completely
Yeah.
where you're coming from as far as that goes.
Yeah. It's great to give them the information because we're educating them, right? And it helps them to we have a lot of participants that are like, this was different than what I used the day before, and it came from the same person, but it tasted different, it looked different, and the way I felt was different. And then to get back the results, then they can kind of evaluate that and be like, oh, that's why, oh, this was in that. That's why I felt this way. And to have that information is good. To have that information in real time before they use, it might not stop them from using. It might though. And
Yeah,
that would be really empowering for them.
yeah, I know. As far as providing any type of educational component to clients, the biggest thing that I found most surprising is xylazine wounds with people who don't inject drugs and they still get them, and they're like, "What are you talking about? I don't use needles." I'm like, "Yeah, but you don't have to for this to happen.
Yep.
You can essentially snort it. You can eat it. Whatever. But yeah, it can still cause these wounds because they come in and you could just spot them. You know exactly what the wounds look like, and so you're like, hey, have you got that look checked out? Anything as far as those natures? Because we do the syringe exchange is we have a room set aside, and we only allow one client at a time, so we can kind of talk to them a little bit more privately. But yeah, especially the ones who don't use syringes but still see some of the things that they're putting in street drugs nowadays is kind of yeah, just see the look on their face when they're like, what? That's from that? Yeah.
When I was using cocaine and crack cocaine 15, 20 years ago, I didn't have to worry about there being fentanyl in it. That wasn't a thing.
Yeah.
And now you have to be aware of that. That's a high risk. And the xylazine is, we had the same experience where we're training our people about the wounds and they're like, I don't understand, I don't inject. And it's like, you don't have to inject it to experience this. So we
Yeah.
explain to them how it works.
Yeah, or the fact that, they're like, well, I've got naloxone, and trying to explain to them, well, xylazine is not an opiate. It's not going to reverse this. Basically you're doing supportive efforts to essentially keep somebody alive
Right.
until the drug wears off. And yeah, that's kind of I've heard it all from throw water on them, throw them in the tub, whatever, just keep giving them Narcan, anything and everything. And it's just like, yeah, those aren't going to work. And the worst thing is the ones where somebody has done some of those things and for whatever reason, the person starts to come back and they're like, oh, this works. And then that spreads like wildfire. And, having to kind of combat that with like, you hate to confront people right there, but at the same time, you want to like let them know, like, hey, like, that's not going to do that. I'm happy they came back, but that is not effective in the treatment for an overdose of xylazine, things of that nature. So yeah, I understand completely. Kev, I'll let you finish this off as far as last questions.
I was going to say, I'm going to add to it. I want to know first, real quick, what is your suggestion to anybody who watches this? And you want them to get involved on the political aspect. What is something you would encourage them to do?
Politically, what would I encourage them to? I would encourage people to figure out the laws where they live, right? I think that's I mean, it's a struggle, right? Because we have federal laws, we have state laws, we have city, like it's all different. I think understanding the laws in your town and in your state are really important. What's legal, what's not legal, and what's the languages around these, right? And understanding that something might be illegal, let's say syringe service program might be illegal because it was in a bill about business zoning that has nothing to do with drug users, but their politicians are going to skirt it in there, right? Let's just go ahead and put this part in the bill and get that passed too. So to understand why the political climate, to understand why things are legal and illegal and what is legal and illegal in their state is really important.
If people want to contact you, whether it's for speaking purposes, therapeutic services, or what have you, what ways are they able to make contact with you?
Michelle Charbonnier. You can find me on Facebook, Instagram, TikTok, LinkedIn, all of those things. My website's michellecharbonnier.com. I do my own coaching and speaking on the side. But Plan Your Recovery at Clayton Behavioral is my private practice where I do therapy, and Mo Network, Missouri Network. Mo Network is the nonprofit. So the best way is probably to find me like on social media, Michelle Charbonnier, and follow me, contact me. I'm always happy to talk. And from there, you'll find all my other, work and the nonprofit and everything else.
And I think this is most important two questions. One is, what do you hope somebody takes away from this? And then follow up with a call to action. What is your call to action for people?
I hope people take away that harm reduction isn't enabling. It's really just radical love, and that it's an effort we're supporting. And my call to action would be for anyone to find their local harm reduction org, the people that are giving out syringes and Narcan and boots on the ground, meet people where they're at out in the streets, find that org and support them. We need financial support, but we offer free lunches and we need people to bring in the free lunches, right? We need water to take on street outreach. There's so many ways to donate. We need people to pack supplies. There's so many ways to give your time. So if harm reduction is something that is piqued your interest, find your local org and support them because they need it.
Thank you. Thank you for that. Thank you, Michelle, for coming on. Thank you, Josh, for leading us today. Sincerely, and humbly, and appreciative of the work that you both do.